Today on Upfront, my extended interview with House Speaker and Janesville Congressman Paul Ryan. Next, the future of health care reform. Can Republicans resurrect their bill to repeal and replace Obamacare? Plus, national tax reform. Ryan on why he's confident a new tax code will be in place by January 1st of 2018. And President Trump and his campaign's contact with Russia. Is Ryan concerned that Trump will fire special counsel Robert Mueller?
Covering the issues important to Wisconsin. This is Upfront with Mike Goucher.
Hello again, everyone, and welcome to Upfront. We begin today with the health care debate and some important questions. Will Republicans be able to live up to their campaign promise to repeal and replace the Affordable Care Act, Obamacare? Could Obamacare just be repealed with replacement sometime down the road? Or will it remain the law of the land indefinitely? Today, we're talking health care, tax reform, and much more with the Speaker of the House, Janesville Congressman Paul Ryan, who joins us today for the full half hour. Speaker Ryan, it's good to have you back on.
Hey, thanks for having me. Good to be back with you, Mike.
So the House did pass a repeal and replacement bill, but the Senate, we really don't know what's going to happen in that. Give me your best judgment today. Are we going to see the repeal and replacement of Obamacare?
I certainly like to think so. My whole argument is we just got to keep working at it until we do, because the situation is very clear. The status quo is absolutely unsustainable. This law is collapsing. Premiums have doubled. 41% of all the counties in America have just one insurer left. Insurers are pulling out of markets left and right. Many counties in America have no insurers left. There's nobody left to offer health insurance in the exchanges. And we're told to experience even greater premium increases in the future. So the law is really in a collapse. So doing nothing is just not an option. We passed a bill we're proud of. I'm hoping that the Senate will get this done. It could be as early as Monday.
Do you think they'll get it done?
I do at the end of the day. We had our own hiccup, our own bump in the road, I guess I would say, and this is the Senate is doing this now. And I think as they look at the possibility of failing, of not keeping our word, which is what this is, as you mentioned in your lead-in, we said we would do this. We ran on doing this.
What would be the impact if you didn't do it?
Well, I think the impact is people are going to lose health insurance. And the health insurers that stay around in the market will become monopolists, not by choice, but by just the market dynamics. And then you'll have massive premium increases. And the people who are in those counties that have no health insurers left won't get health insurance. So, I mean, Blue Cross Blue Shield pulled out of Wisconsin, which is one of the better health insurance markets in the country. They pulled
but we
out
still
of
have
Ohio.
quite a few.
We still have other insurers because we're pretty impressive as a state with respect to health care. We have Dean and we have Marshfield, we have all Aurora and everybody. But the point I'd say is if this doesn't happen, then the law will continue its collapse. And I think a lot of insurers were sticking around knowing that we had good reforms coming, knowing we were going to have tax credits and risk pools and more competition and choice. And if that doesn't occur and happen, my fear is that it will accelerate the pullout of insurers.
A couple of quick questions. Have Republicans contributed to the problems that we see in Obamacare today by the way they have talked about it and by saying that it is in this state of collapse? Why would anybody want to be a part of that market?
I think just stating the obvious and citing the facts is the fact. It's just the fact is this law has given us these massive premium increases and insurers are pulling out.
Subsidies cover some of those increases, you would agree?
Sure, they cover some of those increases, but for people who don't get the subsidies, they're getting massive premium increases. So when you see 20 to 40% premium increases, the premiums have doubled since this law has come into place. Remember President Obama said it's going to lower premiums on average $2,500. It's done the opposite of that. It's gone up about $3,000. So stating the facts and the obvious, I don't think is irresponsible. It just is what it is. The frustration that we had in writing this bill, you and I were just talking about it, is we had to use the Senate rules to write this legislation, which means all the things we would like to do to fix health care can't be in this particular bill, and we followed on with additional legislation. And that's what's frustrating about this particular bill. Association of Health Plans, I'll just quickly say, farmers should be able to buy their insurance through the Nationwide Farm Bureau buying pool, so they have the buying power of all farmers in America instead of just that farming family. That's an obvious reform we think is really good, helps bring down costs, spread risk. You can't put that in this bill because of Senate rules. Things like that are missing from this bill, which makes it an incomplete bill. But when you take together all the things we're doing, we have a complete vision to give us a better healthcare system.
Could you live with simply repealing and then doing something down the road, as some have suggested?
as long as we do something down the road. One of the things.
Does that worry you, though, that
I don't think they have the votes to do that in the Senate.
Okay.
We've done that in the House. We did this in the Senate and the House in 2015, but I'm not sure that or certain that they have the votes to do that in the Senate. If you do that, then what we want to do is let the insurance markets stabilize. The thing that I like most about our bill that the Senate also does is risk pooling. We had a very good risk pool in Wisconsin. 10% of the people in the individual market in Wisconsin were in our high risk pool. They could go to any doctor and hospital they wanted to, and on average, they had better premiums and copays than they get now in our Obamacare. And the other 90% of Wisconsinites were able to buy good, affordable insurance with more choices because those insurance plans didn't have to cover catastrophic illnesses. That's the whole system of a risk pool. What we're proposing is federal financing of state-based risk pools. Basically, what I'm saying is cover the cost of catastrophic care for people with catastrophic illnesses. You get cancer, we're going to cover that. By doing that, the rest of the insurance market doesn't have to cover those catastrophic illnesses. So the person gets the care they need without going bankrupt. And everybody else, the other 90+% of people buying health insurance can buy much cheaper health insurance because it doesn't have to cover catastrophic illnesses. That is basically what we're proposing to do, and then give everybody a tax credit to go buy a health insurance plan and have health savings accounts for your out-of-pocket spending. We think that's a smarter way to go, which will get better insurance, more choices, lower prices, lower premiums, and a stable marketplace. But that is hard to communicate that in this haze of this moment. And what I'm really worried about is if they don't do this, we will have not made good on our promise as a Congress. The House did it. But then people will get hurt because this law will collapse.
Has the president been helpful in this process? He calls you into the Rose Garden and praises you for passage of it, and the next day calls it mean. Has he been helpful?
Yeah, he's had a few slips of the tongue, that's for sure, on things like that. That calling it mean, I think, is just, I just fundamentally disagree with this. I don't think he believes that either, actually. I think he's been extremely engaging and helpful in that he's been working on trying to get members of Congress to yes. He had the senators down there for a lunch just the other day. They restarted their talks. That's because he kick-started conversations in the Senate to get this going. So actually, he's been very helpful in getting people to talk to one another to come to solutions. And that's been the kind of engagement he's had on this issue is more than I've seen any president engage in an issue.
Really?
Oh, yeah. No, it's really something. I mean, he probably talked to 10 people today in Congress, in the Senate, I would venture to guess.
Final question on this. You said that you're proud of the bill you passed, that it's not mean, and yet you've heard the criticism. Congressional Budget Office says 22 million more people would not have insurance after the passage of the bill.
I dispute that.
I know you do. I know. But let me just finish the criticism here, which you're certainly familiar with. It does not fare well in public polling. But polls show that people generally say they want Obamacare fixed, rather than doing something as, more extreme. What do you say to those critics?
Yeah, I think there's just a lot of misinformation out there. I think there's just been a big resist movement that wants more of a government-run, single-payer healthcare plan, so they're trying to stop us from replacing this with a patient-centered system. Here's what we're saying. You buy the insurance you want to buy, and we want to have a system where everybody can get affordable care, including and especially people with pre-existing conditions. And we think the answer of financing extra coverage for people with catastrophic illnesses, having guaranteed protections for people with pre-existing conditions, but giving people a tax credit to buy health insurance of their choosing is much better than the government forcing you to buy a health insurance plan that's a one-size-fits-all, making people buy coverage they don't need or want, and then cranking up the price of that, having no competition, and we're going down to having monopolies in this country from insurance companies that are giving us staggering price increases and cranking up deductibles. That's the status quo. What we're saying is more choice, more competition, lower premiums, lower deductibles, and guaranteed coverage for catastrophic illnesses and people with pre-existing conditions. We think that's a better system because what we want is to have a lot of choices, many insurers competing against each other for our business.
Let me take a break. When we come back, we'll talk more with Speaker Paul Ryan, including we'll be discussing tax reform and the state's efforts to lure the Taiwanese tech giant Foxconn. Does Wisconsin have a real shot? We'll be right back.
Up Front with Mike Goucher, brought to you by the American Transmission Company and the Wisconsin Corn Growers Association.